down to move to the lower extremities. I'm going to start out by locating the dorsalis pedius pulse on both of her feet. I can feel that her pulse is normal 2+, regular rhythm bilateral. I'm going to go ahead and look at her legs. Her legs are warm, pink and moist. I can see hair growth, which means her legs are extremities. Can you please sit at the edge of the bed for me? So now we're going to push your legs against my hand. Pull back. Push up. Go down. Move your ankles up, down, inward. Flex them up, down. Wiggle your toes.
Lift your leg and flex your hips like that. Okay, and back down. And then I'll get you to flex your knee. And then back. So we're just going to flex your hip and extend it back down. Flex your knee and extend it back down. So if you can lift your leg up and push it back down to lie down. And I'm going to check your Achilles reflex. Okay, so next I'm just going to quickly test your Babinski reflex. Okay, so that's just on your foot here. Okay, so I saw just a slight bend in the toes, which is what we want to see. Also, I have a test to do.
Thank you. And can you turn your ankles in and then turn them out? And then can you do the same with your other foot? Thank you. Then can you bring your toes up, point to the ceiling, and then down, point to the floor. And can you flex your toes and straight? Now I'm gonna have you stand up one more time, smooth, and I'm gonna check your capillary refill of your toes. Finished with your assessment, and you did a great job. Thank you for letting me have your time. I'm gonna put the side rail up.
So if you want to lie down for me, Sam, we're just gonna do a cardiac assessment. And first I'm just gonna have you look to your left, just examining for the external jugular vein. I can see a pulse right here. If you could look to your right. Great. All right, now I'm just gonna look at the feet, which the feet are warm and dry to the touch. They're pink, which is great. Looking at the capillary refill, it's under 3 seconds, which is awesome. And then looking at turgor, which is good. And now I'm just going to have you push against my hands and then resist. Great. And could you roll your ankles around, point them in, and then point them out? Awesome. Now just testing range of motion for legs. Could you lift your leg up for me? Bring it down, and then bend at the knee. Great. And then come out to my hand. Very nice. And then we'll do the same thing with the other leg. Bend at the knee, and out to my hand. Very nice. Awesome. All right, so if you want to sit up for me, Sam.
Okay. Do you mind if I remove yourself?
Sure.
Okay, great. Okay. Sorry. No, you're good. Okay, so what I'm going to do is I'm just going to assess your pulse points. Sure. Okay, now I'm going to just have to dig my fingertips in right in your groin area, right here, just to get a femoral pulse, okay? Is that okay?
Yeah.
Okay. Are you ticklish here?
No.
It's an excellent pulse. Great. Bend your foot up for me, put it flat, or bend your knee. There we go. Great. Now your dorsalis pedialis. Okay. So 1 second, essentially instantaneous. Good. That's good. Now I'm just going to push. Sure. Let me know if that hurts. No. No. Good. Does it hurt? Okay, great. So now we're just going to do a little range of motion action. Okay. So what I'm going to have you do is, do you feel like you have any inhibitions, anything that's going to stop you? Okay. So I just want you to raise your leg. So the same thing. Can you bring your left leg all the way out? Great. And back in. Pretty flexible there. Okay. And can you bring that leg all the way up? Great. And back down. Can you bring that leg over and back? Okay. And can you bend at the knee all the way up? There you go. And back down. Okay, can you point and then flex your toes? Can you spread those toes for me? Awesome. Can you roll that ankle out to the side? Yep, just like that, and then back in. Okay, and now can you windmill your toes as much? Yep, and then rotate back. Great range of motion there. And one more thing, I'm just gonna have you sit up as high as you can, just using the bed. Great, looks good. Okay, and then I want you to push your toes all the way in. There it is, and all the way back. Nice, and no pain in any of that, right?
Now I'm gonna ask you to lay down so I can inspect your abdomen. All right, upon inspection, your abdomen looks smooth with no presence of striae, lesions, or any scars of any sort. Now I'm going to listen to your abdomen. First, can you lift your leg up into the air? All right, and then the other leg. And then can you bring your heel up to your knee? All right, good. Now for the other one. And then can you rotate your hip outward? And then for the other one. And then can you rotate it inward? Good. And now for the other one. And then can you move your leg away from your body? And then bring it back in. And the same thing for the other one. Can you bring your knee up towards your face? All right, good job. Now about the other one. And then now for this, I'm going to have you actually lay on your stomach. You flex your feet and then point them and then rotate them in, rotate them out, and then move them side to side. All right, good. Your range of motion all seems normal. Now I'm going to assess the strength of your feet and your lower body. So I'm going to push force against your feet on the bottom, and then you need to push back against me. All right, good. Now can I have you sit up so I can assess the strength of your upper body? Can I have you lay down on the pillow, please? Okay. I'm going to try to locate your point of maximum impulse, which would be around the 5th intercostal space. And they all returned in less than 2 seconds, which is good. Your nails aren't thick. There's no ulcers or anything under your trauma points. Okay. I'm just going to check the capillary reflex too. And it's about +2 over here. Okay, that feels +2 over here too. Okay, I'm gonna check your dorsalis pedis pulse. That's +2. And that's +2 over there too. Okay, I'm going to have you lay down. I'm going to listen to some of your bowel sounds.
Move the chair. Push the chair.
So you're negative for Babinski, which is fanning of the toes. Yes. Yes. Yep. Mm-hmm. Yes. Mm-hmm. Can you push your foot up, dorsiflex? Can you push it down, plantar flex? And same with this foot, dorsiflex, plantar flex. Good. Yes, I am. So I heard 10 things are out. Yeah, I will do light pop. Yeah, you will. I'll do light pop. Okay, so temporal arteries are equal bilaterally and they are a 2+, which is good. Okay, so
Also, if I hurt you, just let me know. Okay. So I'm gonna inspect the inside. No lesions on her stomach as well. So first I'm gonna auscultate, starting in the right lower quadrant. Yeah, you can sit up. Okay, so just looking at the lower extremities, they look symmetrical. They look about the same length, which is good. I'm gonna check the capillary refill. Okay, so cap refill in the toes was less than 2 seconds. And then I'm gonna check the spaces in between the toes. Toes are so cute. Okay, so spaces in between the toes are clear, no signs of fungus or any kind of infection. So now I'm gonna feel for the popliteal pulse.
Gonna check your capillary refill. And it's brisk, less than 3 seconds. Gonna feel your temperature. Your toes are a little cold, but that's not abnormal. While I'm down here, I'm also gonna look at your feet and the heels. I don't see any sores or lesions or discoloration. I'm also gonna check your Babinski, which is negative. It's what we want because you're not an infant. Okay. So now we need to do a little bit of range of motion. So if you can put your legs out again and bend one knee up, straighten and lower, and then out to the side with that same leg. Wow, look at you. Okay. And then with the other leg, bend, straighten, and down, and out to the side. Okay. And can you push against my hands? And can you pull in? Good. And then with your ankles, can you push up? Like here. Pull your toes up towards your nose. Oh! There you go. And then like you're driving on a pedal. Good. All right. Your legs are strong. Jeez. Strong and equal. Strong and equal in strength. Your Babinski was negative. So now I just need to teach you about breast self-examination.
You know where you are? Hopefully you didn't wake up in the DNA book, but I'm not.
2. So again, your skin looks pink. It's warm.
You know what month it is?
Okay, bilaterally. And then perfect. So your circulation is good. Everything's bilateral in the bed.
I'll sit up here.
Let's raise this.
Do you have any pain anywhere?
We'll sit your head up.
Not right now. No. For sure.
Yeah. Feel comfortable?
Yeah. Should be aware of.
So first I'm going to do the front.
Great personal hygiene, I can tell. She has washed her hair. She's taking care of herself. She is dressed appropriately for the weather. It's getting cold. She's wearing pants, and she wore a coat as she came in. Can you let me know your height and your weight?
I'm 5'7" and I weigh 130 pounds.
Awesome. So she is in range for BMI, meaning you're not overweight or underweight. You're in the perfect normal range. And I can tell as I ask her the questions, she doesn't have any slurred speech or any difficulties. Stick out your tongue and open wide. Her uvula, her paint, and her pharynx, her soft and hard plate look nice, healthy, and moist. Great, awesome bright pink color. Lift the top part of her tongue. Under her tongue looks great. Her teeth look all good. Doesn't seem like she has any cavities, but she has to go to the dentist just to make sure. No cracks, no lesions. Her tongue looks great, and no lesions in her cheeks, which are her buccal area. And she also has no odor, meaning she is up to date and takes well of her dental hygiene well. And now I will just be checking. I will now be taking the drupal pedius pulse on both feet. Awesome. They are both bounding. 2+. Call light is, or call button is right here. If you need anything, just press it. Don't be afraid. The doctor will be with you shortly. I will be gone, and I will come back, but no later than half an hour. Do you need anything?
No, thank you.
Awesome.
your ankles. Then do you mind if I take off your shoes?
That's okay.
And your feet. Next, I'm going to palpate your pulses. All right. I'm going to have you go ahead and lay down. Just going to, can you go ahead and lay down? Going to be palpating your liver. So I'm going to press down and go a little bit under your rib cage. Okay. Yep. Any tenderness? Okay. Tenderness here? Here? No. There? No? Okay, go ahead and sit down. Now next I'm going to check your feet. Can you push? Okay, now pull. Okay. Now next I'm going to have you pull out your elbow like this. Okay? And next I'm going to put my feet down here, and I want you to do that with your feet. Just go back and forth, back and forth. Okay, perfect. Now, okay, perfect. Okay, I'm going to hit this. Perfect. Now I'm going to go ahead and assess your reflexes.
I'm going to be assessing your legs, if you could relax. So her legs are equal in color. There's no redness. She has a few primary lesions, freckles, pinpoints on the anterior sides of her legs. She also has a few on the posterior side, in the middle of her calves. There are no, her anterior posterior part, there's also no ulcerations on the posterior part of her legs. There are no ulcerations or lesions in between her toes. Her skin is not moist and is not too dry. So now I'm going to palpate her posterior tibialis. This is also +2 and elastic. If you don't mind just laying down, and I'm going to be examining these. I'm doing these at the same time. Are symmetric. I would grade that as a 2, and I'm going to go into your dorsal pedius. If you don't mind just flexing your feet. So now what we can do is just move on to the thoracic and lung exam. So if you don't mind just sitting up, laying down flat. All right, awesome. So just looking at her contour right now, it's flat, it's symmetrical, nothing seems wrong at all. And then now I'm going to be testing the abduction. If you don't mind just moving your leg as midland as possible. This one? It doesn't matter, you can do whatever. Like, towards your body. Like, yeah. All right, cool. So that was adduction, so that 20 to 30 degree angle is normal, and that's what we saw there, so that's good. So then last thing, if you could sit off the exam table again.
Let me know if you have any pain or tenderness. I'm gonna now do your feet, so I'm gonna just kind of push around on them again. Your toesies are cold. Yeah. Are they always cold?
They're always cold.
Okay. Okay. I'm also gonna check your toe capillary refill, so I'm just gonna push down on these. Okay. Again, making sure that they refill within less than 2 seconds. Perfect, those look great. And I'm gonna feel for some pulses. Okay. I could feel for your femoral and your popliteal, which just shows me that you're getting that good blood flow down to your little toesies down here, which is what we want. We're gonna do some range of motion and strength tests with your legs, okay? So first, I'm gonna have you lift this leg straight in the air. Can you lower it back down, and then lift it up again, and try and push down on my hand. Can you push up on my hand? Great. Now can you swing out as far as you can this way, and then try and pull it in? Great. And then cross it as far as you can, and then try and push it in. Great. Now if you could bring this knee to your chest. Great. And then put this ankle on your knee, and then drop this knee out. Great. And now can you try and turn this knee into that one? Great. Does any of that hurt? No.
Okay, great. Then we're gonna repeat the same process. So straight up in the air, back down, bring it back up, push down, push up, swing out and try and come in. Great, come across, go in. Perfect, and now we're gonna go knee to chest again. And we're gonna put ankle on the knee and drop that one. And then knee to knee again, if you could bring that one in. Great, any pain with that one? Okay, so I'm noticing that everything looks really good here. Again, like your feet look really good, the nails look good, you know, they're not misshapen, they're nice and clean and hygienic, the capillary refill was good. Okay. And the pulses were nice and strong. So if you could sit up for me for a second.
Okay, can you wiggle your toes for me? Good. I'm going to ask you to lay down and do some range of motion exercises with your legs. I'm just going to do flexion extension of the knees, bring up to 90. Good. I'm going to keep your legs straight. I'm going to rotate and the other way for your hip. Good. I'm going to come to the other side and do the same thing. Flexion extension to 90. Good. And now rotation inward. Outward. Perfect. Now if you can move your foot in and out. Good. Range of motion, looks good in all of those. Can you press down on my feet like they're a gas pedal? Good resistance, and now back up. Awesome.
Courtney, do you have any allergies?
No.
And on a scale of 0 to 10, 10 being the worst pain you ever felt in your life, get up, you can sit back. I'm going to make sure the bed is at a 45-degree angle. Okay, how are you? Great, so I'm observing for jugular vein distension, which there's no indications of. Point. Fourth intercostal space, left sternal border for the tricuspid. I'm going to check the capillary refill on the toes, which returns within 3 seconds. I'm going to check the capillary refill on the fingers as well. There's much being negative in adults. Good. Try to push down for me. And pull up. Good. I'm going to have you bend your knee. Just get on assist a little bit. Good. And out. Great. Same thing on this side. And up. And out. Good. Okay, so the last part is the abdominal assessment. Comfortable?
Yep.
Is it okay if I pull your shirt up?
Yeah, it's fine.
So I'm going to inspect for any distension. Her abdomen is flat. So I'm going to go get all the paperwork and chart down all my findings.
Okay. Rennet, I'm going to take your sock off, okay? Sock off. Hair growth, color, any scar, swelling. Okay, that's good. I'm going to check total refill. Good. Okay, good. Total refill. Speed is good. I want to feel for your temperature. A bit cold. But the color is good, so it's fine. So now I want to feel for her elbow side. Dorsal appendage, pause. can feel it, and it's even both sides, so it's good. So now I want to check for your range of motion. Do you want, can you move your knee up to your chest? Okay, that's good. The other one? Okay. Do you want to move your legs out, back, and the other one? Okay, that's good. Do you want to pull it? Pull. Pulls. Okay, good. Push, push. Okay, that's good. What I do also do range. Can you wiggle your toes? Okay, that's good. I will also check for the biscuits for reflex when she laying down. Okay. Okay, that's good. Okay, now I want to ask you to sit to the edge of the bed.
Can you please put your legs up on the bed? Thank you. Her legs are tan with no color variations on the anterior or posterior sides. They are bilaterally shaved, and the hair follicles are evenly distributed anteriorly and posteriorly. And then on the posterior side, I don't see any lesions. She has another primary lesion, freckle that's flat, and then a birthmark posterior on her left leg. That looks about good. I don't see any vascular lesions. I don't feel any edema or inflammation in her legs or her feet. There's no lesions between her toes. There is a primary lesion on her foot right there. It's a freckle. It is flat and pinpoint. There's no ulcerations on the anterior or posterior sides of her legs. So now I'm going to palpate her posterior tibialis too. Did you have any tingling or numbness in any of your extremities? No. Perfect. So now I would place my patient in BIC.